Welcome back to Collective Practice. I'm Lauren Spalding, and if you're new here, this is a podcast for mental health entrepreneurs where we talk business skills, clinical skills, and mental health. And today I wanted to talk about retention in your business. And I wanted to address this because it is a common concern for newer therapists or therapists who are new in their business and building up that list of referrals coming in. We've all experienced this where you schedule new clients, you've got a good bit on your calendar, you meet with them, maybe some you meet even a few times, and then all of a sudden some of them just fall off your calendar. They don't schedule their next session, or they cancel and they ghost you, and you are feeling disheartened. What's going on when that happens? Why is it that some clients stick around while others decide to terminate therapy early on? Well, one of the top reasons that clients decide not to continue with a therapist is because they don't feel connected to you. It's as simple as that. Therapy is found to be more successful when a client and a therapist feel like a good match. When clients report that they feel connected to their therapist, where they feel a sense of relationship and they feel on board with the therapeutic interventions that their therapist is suggesting, because there is trust and safety built into the relationship. Relationship is a huge part of what we do. It's a huge part of our success as a therapist. We are our services that we provide. We are our brand. We are our business. When someone is looking to work with you, they aren't just looking for a therapy model, and they're not even always looking 100% for a solution. They are also looking for someone that they feel connection to, that they feel some sense of rapport with, and they want to feel that pretty early on in the therapeutic relationship. So, what can happen when we are trying to fill up our calendar is we get very focused on what services we're providing. What's my therapy model? What's the solution I'm helping someone reach? How can I get someone from point A to point Z is kind of how it feels, because there's so much in between. We know that a lot of times when clients see us, it's not just that surface level problem that they talked about you in that intake call. It tends to go deeper, and you tend to work on more things and more steps to get to that final goal. It can be very, very tempting to walk right into that therapeutic model, to start offering interventions, and to just go with what you know. We get a little bit intellectual and in our cognitive brain when we are thinking about keeping a client. If we are sitting in anxiety of providing the best services, making sure that that retention rate is good, we actually can sometimes take a misstep by falling too quickly into the therapeutic process around the model that you're bringing into therapy, and we forget a huge aspect of the therapeutic process is the therapeutic relationship. Things like countertransference and transference are happening in the room. Things like rapport building are happening, and things like getting to know your client more should be happening in those first sessions. It should not be all taken down and done in your intake paperwork. And it also should not be all done in that first intake session. You should slow down the process and take a few sessions to really get to know your client, really get to understand not only what brings them to therapy, but who they are as a person. Really get to know their personality, flesh them out more as a human being rather than a patient. And give your clients time to really get to know you, to feel really comfortable with you, to build that trust and safety that they can be themselves in this room, that they can open up to you, that they can be honest, and that actually that's going to be the best thing for their therapy. If you take the time to slow down that process and really intentionally build that rapport, you are going to see more therapeutic success with your clients as you start moving into interventions and different phases of whatever therapy model it is that you're bringing into the sessions. You are also going to experience better retention. More clients are going to stick with you and continue to schedule with you when they feel a connection to you. A lot of times we get bogged down by the concept of being an expert in a therapeutic model and a therapeutic approach, really understanding the theory that we are coming from and really conveying that in our therapy sessions. We are bombarded with book recommendations, continue education opportunities, webinars, workshops, retreats, all of it can feel very overwhelming and can make us feel like that's what we need to focus on in order to be a great therapist. Well, I'm here to let you know that I know plenty of therapists who have not gone through all of the steps to become an expert in a specific therapeutic approach, or have not attended all of the CEU opportunities that are presented to them, and still were able to create a full calendar of clients. I know therapists who really haven't solidified yet what their niche is, or really haven't solidified yet what specializations they want to go into, and yet they are able to fill up their calendar. And their secret is they are very good at establishing that rapport early on, right away. They take their time when they're replying to email inquiries, when they are on that initial phone call, to make sure the person calling in is the right fit and is going to feel like their needs are met in the therapy room. And when they know confidently that this person is a good person to work with them, they get them on their calendar and they slow down the process. They really take the time to get to know the client and really establish what we are going to be doing together in the therapy room. I always think of the reference from The Boy Who Was Raised as a Dog. This book is by a trauma therapist who talks about different cases where he worked with children with trauma, with very, very severe trauma in their history. And one story was a boy who was raised as a dog. He was raised in a dog kennel. He was raised around other dogs. He ate and slept and played like a dog. And he ended up in the hospital, and none of the nurses or doctors could work with him because he was so afraid and so out of his element and didn't get to develop any of the social skills required to interact with other people. And so this therapist was called in and asked to help this little boy. And he noticed that everyone was trying to force this child into trusting them and force this child into feeling safe enough to allow them to do all of these medical interventions on him. And so what this therapist did instead is he met that boy where he was at. The little boy was, in a kennel, shriveled in the corner, terrified, growling at him. And all this therapist did was sit with the boy. He sat in front of the kennel. He did not reach in. He did not grab at him. He did not force conversation. He did not ask invasive questions. He just sat with the boy. And eventually, that boy started to feel safe and started to slowly come more and more out of the kennel and eventually connect with this therapist so that the therapist could help him. Of course, we aren't all seeing clients with severe, severe trauma. Some of us are. Some of us are trauma therapists. Some of us work with complex trauma, and this story doesn't feel as far-fetched as someone who is not a trauma therapist. But we are still working with someone who is feeling dysregulated, who's feeling overwhelmed with whatever is occurring in their life, who might be feeling hopeless or helpless, who might be feeling like nothing can ever change or that they can't be helped, who might be feeling like they have no idea what to do next. They're feeling confused, they're feeling lost, they're coming to you to help them navigate what feels like a very dark path. So even when we have clients who are saying, I need help and I need it now, if we give in and rush too much into therapeutic intervention, we do risk pulling the rug out from under them because we haven't yet established a foundation of safety for them. If your new client is demanding change right away, is demanding therapeutic interventions, I know what I want it now, let's go, and we feel that pressure, we need to recognize that they're coming in with fear. They're coming in with a lot of fear that change is never going to happen, that they have no idea what to do next. And we need to meet the needs of that fear before we go into any type of interventions. We need to recognize what's underneath the words and meet those relational needs, those human needs for relationship, for safety, for comfort, for support before we move into anything else. And if you do this, if you take just a few sessions to do this, you are going to see a better retention rate with your new clients. I will add an additional note that if you have a client who just really needs some type of action items to feel comfortable with therapy, and you're recognizing that that actually might be a part of rapport building with them, go ahead and give them a little bit of homework, or go ahead and give them some assignments to do in therapy that are still relationship building. That homework could be things like, I want you to notice and name your emotions this week. I want you to notice how your body feels when you're in these emotions. I want you to notice the triggers that are coming up around those panic attacks. It could be little bits of homework that are still slowing down the process. They're not too homework heavy, but it's building that rapport that you might be noticing for clients who are really asking for something to do. Or maybe you're having them do something like journal in the session, make a collage. Maybe you're having them sit with their body and telling them that's the action item in the therapy session. Or maybe you bring in a little bit of psychoeducation. You talk about the brain and why it's important to go a little slower in therapy and how that can lead to lasting effects. You want to make sure that you are establishing yourself in your role as the therapist, that you're building a sense of safety by having those boundaries, that we're not going to go too quickly, that we're going to explore the nuances of the issue you brought to me before we just make assumptions and dive in. Slowing down and being with your new client is ultimately going to meet a lot of needs for their system that is feeling all jumbled and all over the place. It's going to help ground your new clients. It's going to help set some expectations for someone who has no idea what to expect in therapy. And it's going to help that overall fear or dysregulation that they're bringing into session. And when someone can feel grounded, when someone can feel like they can pause and breathe for a moment with someone, and when someone can feel like they can show up authentically as they are without immediately being challenged to change, they're going to feel a connection to you, and they're going to want to continue doing therapy with you. And ultimately, that's what's going to get you the retention that you want, and that's what's going to get you referrals in the future as well. Whenever this person is done with therapy, or even during therapy, they might have appropriate referrals that would not be a dual relationship, and they're happy to share your information because they are experiencing something new, different, and better with you. Remember that therapy models and continuing ed are for us. They're for us to get better at our art as a therapist. They're for us to get better at our skills, to really hone in what we do and how we do it. But they're not for our clients. Our clients couldn't care less the label of the intervention that you're bringing into session. They are just coming in to hopefully get some help and support. That's it. And there are so many different ways that can be done. There's no one therapy approach that's perfect for everyone. But the one thing that is consistent across the board with any therapist with any type of training is that when someone feels really seen, really heard, and really understood, they do feel that therapy is successful for them. So I want you to try this out. If you are noticing you are struggling with not only gaining new clients, but keeping them on your calendar, really take the time and notice if you can slow down the processes in any way, or if you need to shift how you're rapport building in any way, and see how those numbers go up for you. Thanks so much for spending time with me today. As always, be sure to rate, review, and subscribe. It's free, and it's the easiest way to support this podcast and help it reach even more people. Be sure to share today's episode with a friend, a colleague, or anyone who could benefit from today's information. And don't forget to follow me on my other social medias where I post even more free content for mental health entrepreneurs, therapists, counselors, social workers, and the like. That's everything I've got for you today, so I'll look forward to seeing you in the next episode. Bye!